Hello, I'm Jada, and I chose to do a speech on breast cancer. For one, it's Breast Cancer Awareness Month. It is October, so I think it's very important for people to be more aware, if not aware at all times this month, of breast cancer. I don't think that there's many people that you can talk to that haven't been affected by any kind of cancer in any way. Me personally, I've had to deal with it because my grandma was diagnosed with cancer about 2 years back and she had to have her left breast removed. So I just think it's really important that people are aware of breast cancer and aware of the symptoms, how to prevent it, and everything like that. First off, we're going to talk about the definition of cancer itself. It is a disease caused by an abnormal growth of cells in the tissue, so they keep dividing and dividing and uncontrollably. Breast cancer forms in the ducts and lobules of the breast. So it happens to be a form of cancer and it's called carcinoma. That is one of the many types of cancer. There's 7 main types of cancer. It is the most talked about cancer in society today. There's a lot of support for it. I'm not saying there's not support for any other cancers, but you can probably count out or name some of the organizations that are associated with breast cancer. It is the second most common form of cancer in women aside from skin cancer, and every 1 in 8 women develop breast cancer in their lifetime. The causes of breast cancer can be genetic, hormonal, lifestyle, and dietary or environmental. Of course, most likely, if you're a woman, well, women most likely are the people that get breast cancer, but breast cancer is a disease that can be among men as well. Risk of developing the disease grow as women grow older. So if you're an average 30-year-old woman, you have a 1 in 280 chance of getting or developing breast cancer, and then the chances grow steeper as you grow older. White women are the most at risk, but African American women are not exempt from breast cancer. Like I said, my grandmother was she struggled with it. She had to go through chemo and she had to have surgery, so it's not exempt from African American women. It is also hereditary. So if your grandma or your aunt or your mother or your sister, anyone in your family that's had it, it's really important for you to go get checked as well. Especially if the cancer was worse. So it's really important for people to go get that checked out if it runs in the family. Like I said, breast cancer is affected by your diet. So if you have countries with high intake of fat are at higher risk of their women developing breast cancer. Overweight people or obese people have a steeper chance of getting breast cancer. So regular exercise helps out a lot with preventing breast cancer. Alcohol also prevents breast cancer. If you don't drink it, that means you will have a less chance of getting it. Early breast cancer is most likely it'll be painless and there's hardly any symptoms. So most people figure out that they have breast cancer by feeling the lumps in their breasts. That's the most common symptom of early breast cancer. Whenever they do find the breast lump and they run tests, that's called staging. Staging depends on the size of the tumor and the size of the lymph or the number of lymph nodes that are affected, and it depends on how much the cancer has spread. So there's 7 stages of breast cancer. You go from 0, 1, 2, 3A, 3B, 3C, and 4. Obviously, those go in from best to worst. It's best to catch cancer at an early stage, at the 2 earliest stages, which are 0 and 1. 2 is it's not as good to catch it at that stage, but it's better because it's easier to get rid of it. 3 is it's called the advanced stage, and that's when the cancer has spread to other tissues. 4 is the most severe stage of cancer. Unfortunately, doctors, most of the time, once it's caught at stage 4, there's usually nothing you can do. I mean, you can go through chemo, a woman could go through surgeries, but there's usually not much time left to get that figured out. Treatment. You could go through surgery, radiation, or chemo. Surgery, there is a mastectomy, or you could get partial surgery, which only takes out part of your breast. Mastectomy is when you have your whole breast removed. Unfortunately, my grandma did have to have her whole breast removed and then had to go through chemo after that. Radiation is just basically really strong x-rays that eliminate the tumors or make them smaller. And chemo are drugs that are inserted by pills. They can be inserted by a needle, and they help reduce the size of the tumors as well. Prevention, you can always, always, always prevent breast cancer. Ways of prevention are just being aware of it. If you know it runs in your family, just make sure you're self-examining yourself. Make sure you're getting those mammograms on time, because those really do pay off in the end. There are many breast cancer foundations in America today. There's the National Breast Cancer Foundation, National Cancer Society, and the Susan G. Komen. They stress the awareness of breast cancer, and I think they do a lot to support breast cancer in general. I think it's really important for women to be aware of this and to go get examinated, help prevent, help spread the word, and that's it.